Shadowing in the Adnexa. What are the differential diagnoses? This case was that of a 60-year-old multipara who was 5 years postmenopausal and presented with a long-standing history of abdominal swelling. Ultrasound revealed a solid lesion with extensive shadowing in the right adnexa. So, what are the differential diagnoses of shadowing in the adnexa? Mature cystic teratoma, fibroma, cystaderofibroma, and broad ligament fibroid. So let's see the video and decide which of these is the most likely differential diagnosis. Bladder, the right corner, you can see the tube, and this huge solid right adnexal lesion with extensive shadowing such that one cannot see the lower portion of this lesion because of extensive shadowing. Here look at these calcifications with tip of the iceberg sign, here with tip of the iceberg sign, and look at here what looks like bright lines and dot, which is suggestive of here a mesh in fat. Here you can see free fluid in the peritoneal cavity. So let's play the video. The bladder, the uterus. Look at this free fluid. Has actually delineated that this mass is not arising from the uterus, as you can see here. So this mass is not arising from the uterus. So not this extensive calcification with shadowing, not the lobulated nature of this mass. Again, not the extensive calcification and shadowing, free fluid. Look at the cervix, fundus of the uterus. This lesion is not attached to the uterus. You can see that free fluid, mass not attached to the uterus. This is the fundus. You can see the right corner here, and not the fact that this is not arising from the uterus. And look at the lobulated nature of this mass. Tip of the iceberg sign. What looks like bright lines and dot. This is the bladder. The gain setting is high, and that's probably why we are seeing this debris. So you can see this mass here pushing the uterus up and stretching the cervix. Not this small endometrial polyp, the bright edge here. Again, not that cervix, uterus. So this mass is not arising from the uterus. So what could it be among the differential diagnoses? Could it be mature cystic teratoma at this age, 60 years? Of course, it's a possibility because of this extensive shadowing, tip of the iceberg sign, and what looks like bright lines and dots, which is a feature of mature cystic teratoma, not the lobulated nature. Could it be a fibroma? Yes. Fibroma is also a solid lesion. Of course, it could be unilocular solid in some cases, in about 20%. But it can also give this shadowing, but I'm not sure whether the shadowing will be as extensive as this. What about cystaderofibroma? It's unlikely. because cystoid fibroma is generally a unilocular solid lesion. What of broad ligament fibroid? Broad ligament fibroid likely to be attached to the uterus. Here there is no attachment to the uterus. So you can see the still image. Because of the size, I couldn't measure it in a single plane, but I had to use split screen to measure. You can see the length is about 17 centimeters. And here, look at these bright lines and dot. Look at this tip of the eyes backside, which to me suggests that this could be a case of mature cystic teratoma. But as surgery, look at this. Lobulated, yes, we have seen that. Here you can see the whole appearance. This is the tip of uteri fibroid. Here you can see the bright edge of the endometrial polyp, and you see the polyp here. So, histologic diagnosis, you can see hyaline and calcific delineation. You have seen the calcific changes here, and of course the polyp here accompanying tissue because it was separate from the uterus. It was a live myoma. So, what this suggests to me is that this is likely to be a case of parasitic fibroid. Thank you very much for listening.